Hello and welcome to Prisma Health Children's Hospital, located inside Greenville Memorial Hospital. Today, we're going to teach you what it is like to get ready for surgery. Pay close attention just in case you need to come to the hospital one day and get ready for an operation. Let's get started. When you arrive at the hospital, you'll be directed which way to go. Now it's time to ride the elevator up to the second floor. Once you get to the second floor, it's time to let the person at the desk know that you've arrived. It might take a few minutes to get the room ready, so you can just hang out in the waiting room. Next, it's time to meet your nurse. First things first, we'll need to see how much you weigh. All you have to do is hop on the scale. Then you will go to your room. We call this the Get Ready room. When you get to your room, the nurse will give you some things to wear. You'll get a hat, socks, and hospital pajamas to put on. Once you're changed and comfortable, your nurse will do a quick check of your body, like what they do at your doctor's office. First is checking your temperature. That is a quick touch on the forehead. Next is blood pressure. That is a tight hug on the arm. Last is checking your oxygen. That is a little clip on the finger. It glows red to let your nurse know it's working. The nurse will also go over some questions and ask your parent or caregiver to sign some papers. You can watch TV or do some activities while you wait. One of the people you will meet is the Child Life Specialist. They will help you get ready for surgery and are here to help you understand what is going to happen today. They are here for you to ask any questions that you may have. The Child Life Specialist will help prepare you for surgery. They can show you pictures of the operating room and even let you touch some of the medical equipment. For surgery, you will be given anesthesia medicine to go to sleep. This is so you won't see, feel, or hear anything during your surgery. Your anesthesiologist will decide the safest way for you to take your anesthesia. Most younger children will breathe sleepy air through a mask. You can decorate your mask that you will wear in the operating room. You can choose what stickers you want and even pick a chapstick to use inside your mask to make it smell better. Now it's time for you to meet your doctors and all the people at the hospital who will be caring for you. Check out their green uniforms. These are called scrubs, and the green color means they can work in the operating room. There will be a surgeon, anesthesiologist, OR nurse, and CRNA, to name a few people who will be caring for you. They will come in one by one to say hello and answer any questions you and the grown-ups might have. They will tell you all about their jobs and how they will take care of you. Now it's time to go to the operating room. The CRNA, which is short for nurse anesthetist, is going to drive your bed back to the operating room. Your parent or caregiver will wait in the waiting room for you to be done with your surgery. The operating room is where patients go to have their surgery. Everyone in the operating room is wearing green scrubs, hats, and a mask. This is so they can keep the room extra clean, and so that they can help prevent spreading germs during surgery. Next, you're going to scoot onto the operating room bed. This bed has a warming blanket to help you feel more comfortable. When it's time for you to go to sleep for your surgery, the CRNA will help you hold your mask over your nose and mouth. You will take some deep breaths. When surgery is all done, you will ride in your bed to the recovery room. Your parent or caregiver will be there with you while you wake up. You might feel a little sleepy at first, but soon you will start to wake up and feel more like yourself. Once you are more awake, you can have something to drink or a popsicle to make sure your tummy feels good. Some patients stay overnight in the children's hospital if they need a little extra care. And some kids go home the same day. Before you go home, your nurse will ask you and your parent or caregiver a few questions and give you instructions for going home. When it's time to go home, the nurse will take you for a ride in a wheelchair back down to your car. Thanks for joining us and learning more about what to expect if you have surgery at Prisma Health Children's Hospital.